Good afternoon, everyone, and welcome to our Tuesday afternoon here in Toronto Zoom training on some of the products from Greenworld and some of the systems, the body systems. It's nice to see you again, and I hope you're going to enjoy and take away some few things from this training on pancreas and diabetes. So I will talk a lot about diabetes, but before that, I'll try and describe what the pancreas does, what it is all about, and also I'll change gears and deviate a little bit from the Western medicine and talk about traditional Chinese medicine as regards to the pancreas and the spleen, because I was asked to talk about the spleen and the pancreas. But in traditional Chinese medicine, indeed, this defines the spleen and the stomach as the digestive system. But let me just get this going. Yeah, so in traditional Chinese medicine, the spleen and the stomach are described as the digestive system or part of the digestive system. But the spleen also in traditional Chinese medicine doesn't refer to the same organ as in the Western medicine. The spleen in traditional Chinese medicine means the functions of the digestive system. It doesn't refer to a particular organ, as we all know in Western medicine. From an anatomic point of view, the spleen is an organ of the immune system. So I shall talk about the pancreas. We shall leave the spleen alone to the topics of the immune system for another day. The pancreas is an important organ of the digestive system. It actually plays dual parts for endocrine system and digestive system. As a digestive organ, it helps with digestion. The pancreas helps with digestion. As an endocrine organ, it helps adjust the blood sugar levels. We will talk about this later on. When we chew the food, our pancreas begins secreting digestive juices going to the small intestine. This digestive juice is loaded with enzymes such as lipase to digest fats, amylase to digest carbohydrates, and chymotrypsin and trypsin for digesting proteins. So this is part of the pancreas, what it does. As part of the endocrine system, this pancreas secretes two main hormones to regulate our glucose. Our glucose levels in the blood should be regulated. Otherwise, we start to suffer from many health issues. So the first is the insulin, the first hormone that is secreted by the pancreas that I'll talk about is the insulin. After each meal, the pancreas secretes this hormone to lower the blood sugar or blood glucose when it gets too high. So insulin is produced by beta cells of the islet. This is part of the insulin of the pancreas. There are certain cells called beta cells in the pancreas that actually secrete and produce this insulin. The second hormone that is produced by the pancreas is called glucagon. Glucagon. So have you had such an experience that after you fast for too long or skip one meal, that you may feel hungry, but if you hold on to that for around 20 minutes, this hunger actually fades away. You start to feel the pangs of hunger fading away after you take 20 minutes without eating. This is the work done by this hormone called glucagon, secreted by the pancreas. The glucagon is released when glucose levels get too low. Glucagon is produced by the alpha cells of the islets in the pancreas. So those are the two hormones produced by the pancreas, the insulin and the glucagon. In our bodies, there are several hormones raising the glucose levels, but only one hormone, which is the insulin, actually lowers the glucose level. So now we talk about the pancreatic disorders, pancreatitis. There are three major disorders of the pancreas. There is pancreatitis, there is pancreatic cancer, and of course we have diabetes. These are three major disorders of the pancreas, and these are due to the pancreas dysfunction. Pancreatic cancer is one of the most pernicious cancers, one of the most deadliest. If not caught early, you may not have chance to survive long. It is not a condition we can handle, this pancreatic cancer. But we will talk about diabetes instead. Diabetes is a metabolic disorder closely related to the dysfunction of the pancreas. We shall discuss it later. Let us first share about the pancreatitis. There are chronic and acute pancreatitis. The latter needs an immediate medication, this acute pancreatitis. What healthcare products can address this chronic pancreatitis? The digestive juice produced by pancreas or by the pancreas is supposed to be secreted into the duodenum. From this diagram, we can see that the green colored organ is the gallbladder. You can see the gallbladder here, over there, here. That green colored organ is gallbladder, and the bile flows into the duodenum through the bile duct. That is the bile duct. That's the gallbladder. There is a duct that flows into the small intestine. Okay. And the pancreatic juice flows into the duodenum through a pancreatic duct. That is pancreatic duct there, through here, and flows through the small intestine. Right before both ducts meet, the duodenum, they actually merge as one. If somebody has gallstones, the gallstones can actually fall into the common bile duct, which is the section where the two ducts join. Even a partial blockage can stop the pancreatic enzymes from traveling to the small intestine and forcing them back into the pancreas. These enzymes then begin to irritate the cells of the pancreas because they go back, they flow back because they've been stopped by the gallstones, and they flow back into the pancreas, irritating the cells of the pancreas and causing the inflammation to occur in this pancreas. This is one of the reasons for chronic pancreatitis. Another cause of chronic pancreatitis is drinking too much alcohol. Drinking too much alcohol is no good. It may only last for a few days on a sudden occasion. When you celebrate, you have a feast, but it can also become a chronic condition that lasts for years if you're not careful. Pancreatitis can cause multiple symptoms, including abdominal pain, fever, and vomiting. If the common bile duct or pancreatic duct are completely blocked, acute pancreatitis occurs, and this is where you should seek medical attention. Greenwood products may not be able to help much in this case. All right, so let us talk a little bit about the chronic pancreatitis caused by the gallstones. How the gallstones are formed, or why somebody has gallstones. Normally, our bile contains enough chemicals to dissolve the cholesterol excreted by your liver. But if our liver excretes more cholesterol than your bile can dissolve, then the excess cholesterol may form into crystals and eventually into stones. We can draw a conclusion that if we control our cholesterol levels, we can actually lower the risk of getting these gallstones in our gallbladder and the ducts that are associated with it. Okay, so that is why we care so much about our different parts of the body, the gallbladder, the pancreas, and the ducts, and we keep our cholesterol levels low. Otherwise, they may start to, the cholesterol itself may start to crystallize and turn into stones, which can block some of these ducts that are important for the enzymes that are required for digestion to flow through and go into the small intestine to do its job of digestion. What are the products that can lower our blood cholesterol so that we can avoid these kind of gallstones into going back into blockage of the ducts and affecting our pancreas? Greenwood has 3 products that can help lower the cholesterol levels. The first product is lecithin capsule. Lecithin capsule, that one, it is found in the US market, in the US office, the branch office in New Jersey. So you can always order it through there online if you are in Canada here or in the United States as well. Now, lecithin capsule has certain things of interest. First of all, choline in this lecithin carries the bad cholesterol like LDL to the liver to be processed. So that is one. It carries the bad cholesterol, one of the ingredients of lecithin, carries this bad cholesterol, LDL, to the liver to be reprocessed. Besides, lecithin works as a solvent that prevents the cholesterol from sticking and accumulating on the arterial walls and keeps it dissolved in the bloodstream. It has also been found that lecithin triggers the function of esterases, which are enzymes that help break down fats or metabolizing fats, thus helping in the more consumption of fats that helps in lowering the levels of this bad cholesterol. So lecithin is important in reducing the levels of bad cholesterol in our bodies. That's a very important product. It will help you with your liver, with your gallbladder, and with your pancreas. Now, the second product is hempseed oil, or we can have omega-369. And if you are in the United States, you can also have super omega. All these products are sources of omega-3 essential fatty acids. And we have DHA and EPA, which can reduce the levels of LDL, the bad cholesterol, and triglyceride levels as well. These are fats that start flowing in your blood, while increasing the level of HDL, the good cholesterol. Omega-3 fatty acids also have an anti-inflammatory effect in the body, and therefore they can decrease the growth of plaque in your arteries. So very important. You should be taking hemp seed oil or omega-369 or super omega almost daily to avoid the growth of plaque in your arteries and reducing the width of your arteries, which can lead to high blood pressure and so on, and clots and strokes. High blood pressure can also lead to things like heart attack. Okay. Now, the third product is lipid care tea. With 6 herbal ingredients in this tea can help burn fat and lower cholesterol and triglycerides levels. So replacing your soda drink, your commercial juice with lipid care tea is a great step forward towards good health. Avoid those sodas. You may choose either lecithin or omega-369 or hemp seed oil or super omega, plus lipid care tea, all which can put your cholesterol level under control. So these 3 products are very good for putting your cholesterol levels under control. So in Greenworld, we are happy to show you that we have products that can help lower your blood cholesterol. All right, so here are the products that can protect your liver against alcohol. I'll talk a little bit about alcohol. After alcohol enters your body, in the liver, the alcohol is broken down by an enzyme called ADH, otherwise called the alcohol dehydrogenase. This is an enzyme that breaks down the alcohol into acetaldehyde. Acetaldehyde is even more toxic than alcohol itself. So when you drink alcohol, there is an enzyme in the liver called ADH, alcohol dehydrogenase, breaks these alcohol molecules into what we call acetaldehyde. Those people who know more about biochemistry, they know about acetaldehyde. It's a toxic compound that comes from alcohol breaking down in your body, but is more toxic than alcohol itself. This explains why hangovers are more painful than the first day of drunkenness. Okay, so that's why hangovers are more painful. You have more pain in your body. You feel bad. You feel wasted because of this acetaldehyde. The acetaldehyde is then converted by another enzyme called ALDH, otherwise known as acetaldehyde dehydrogenase, to acetate. So it's now converted to acetate, which is similar to vinegar and much less harmful. So eventually your hangovers start to fade because of these chemical processes that take place. Unfortunately, people with mistakes in their genetic code of LDH, some people don't have enough acetaldehyde hydrogenase, ALDH, their genetic code is a little bit faulty. So they cannot break acetaldehyde down. So when they drink alcohol, this causes the harmful substance to build up in the body more and more. It is a carcinogen, this acetaldehyde. a substance that induces inflammation and certain types of cancer. So that's why it is dangerous to keep taking alcohol. Some people actually, when they take even a little bit of alcohol, they may start feeling so bad the following day because they don't have this extra enzyme to break down the acetaldehyde, which is a toxic compound. So can induce inflammation in your body and also can induce certain types of cancer. So be aware of this. Now, Greenwald lastly introduced a product called Fresh Drink Ju Ching Ching solid beverage. Fresh Drink Ju Ching Ching solid beverage with 10 natural ingredients. This product can help the breakdown of the alcohol and reduce its side effects on the pancreas and the liver. So if you take alcohol, or if you know anyone who loves a few shots during the weekend, you can recommend this product to them. It's called Fresh Drink Ju Ching Ching solid beverage. Can help to break down the alcohol faster. And you may not experience the dreadful headache and drunkenness and so on, hangovers that are a byproduct of alcohol. Now let us talk about today's main topic, diabetes. According to the World Health Organization, the expected number of diabetic patients will surge from 382 million diabetics in the world in 2013 to around 592 million by the year 2035. In Europe, there will be an increase of 56 million cases of diabetes within the next 15 years. So those are alarming statistics. Very, very alarming. As you can see on this slide, there are cases of diabetes, South and Central America. Those are in millions of people suffering from diabetes. Africa, 20 million. Western Pacific, 138, and so on and so forth. So one person dies of diabetes every 6 seconds in the world, and 5.1 million deaths overall in 2013 occurred. So those are some of the statistics from the World Health Organization, and the alarming means that diabetes is actually an epidemic, although it is not termed like that. Okay. So currently 1 out of 12 people are diabetic in this world. Unfortunately, 1 in 2 who are diabetics, or 1 person in 2 people, one person in 2 actually don't know they don't know that they have diabetes, simply put. So considering this group of people who keep on joining the diabetic group, every family might have one of their family members who's diabetic. So let us dig deeper into this topic so that we are able to help more people, because these statistics are very alarming. I can see that this is a very, very discouraging when it comes to this kind of statistical numbers, diabetes. Okay. So let us see. In our diet, bread, pasta, we have rice, we have cereals, fruits, and veggies. These all provide carbohydrates, an essential nutrient for us. Those carbohydrates are broken down into glucose in our small intestine, where they make their way into our bloodstream. Glucose is the principal source of fuel that our cells use for energy and growth. However, glucose cannot enter our cells without insulin being present. Insulin makes it possible for our cells to take in the glucose. After a meal, our blood glucose levels rises. It triggers the secretion of insulin to move the glucose present in our blood into the cells. As soon as glucose enters the cells, blood glucose levels then drop down. If we use a metaphor, our pancreas can be the factory making the insulin. Our cells where glucose is converted into energy are the powerhouses. Insulin is the key that unlocks the door to the cells, and the lock is the insulin adapter or receptor that occurs on the surface of the cells. Now, a person with diabetes has a condition in which the quantity of glucose in the blood is too elevated, which is sometimes called hyperglycemia. This is because the pancreas either does not produce enough insulin or produces no insulin, or has cells that do not respond properly to the insulin the pancreas is producing. So using the same metaphor, either the factory shuts down or is not in its full capacity, or it doesn't produce efficient keys. So the doors of the powerhouses cannot be unlocked. Thus, the glucose cannot enter the powerhouses. This condition results in too much glucose building up in the blood, and the powerhouses are getting starved. So that is the condition of diabetes. That's in simple description. We have the powerhouses, the cells, and we have the locks, which are the cells, and then we have the insulin, which is the key that opens the powerhouses so that the insulin can allow the glucose to enter. So now there are types of diabetes that we currently know. Clinically, diabetes is categorized into 3 types: type 1 diabetes, type 2 diabetes, and gestational diabetes. These are the 3 types that we currently know. Well, there are other people now trying to go and say there is also type 3, which occurs and may be responsible for things like dementia or Alzheimer and so on. But I'm not going to talk about that today. Okay, so type 1 diabetes. Type 1 diabetes, the body's immune system actually starts to destroy the beta cells of the pancreas. I talked about beta cells. These are the cells that produce insulin. So if the immune system starts to destroy these beta cells, then it means that the pancreas is not capable of producing the insulin. Thus, the body stops producing insulin. And so people with type 1 diabetes need to take insulin injections for the rest of their lives. People usually develop type 1 diabetes before their 40th anniversary, their 40th year, often in early adulthood or teenage years. Approximately 10% of all diabetics are type 1 diabetes. So that is a lot of people. 10% of diabetics are almost type 1 diabetes cases. I'll talk about gestational diabetes. This is a condition in which the blood sugar levels become high during a woman's pregnancy. During this stage, women's body produces many hormones to sustain the fetus growth. So lots of hormones are swirling through the woman's body, and these hormones may actually interfere in the function of the pancreas, thus causing insufficient insulin secretion in the bloodstream. So this is when things start to get murky, and a pregnant woman with this condition, with the hormones that are affecting the pancreatic function, start to get high glucose levels in their blood, in the bloodstream. So both type 1 and gestational diabetes need medication. Thank you. They need medication. So both type 1 and gestational diabetes, they need medication. So here in Greenwald, we are not able to help too much about these two. For type 1 diabetes, if the patients actually agree, we may just recommend our products to help control some of the complications, but they will, I think, continue to take the insulin injections. I leave gestational diabetes to the physicians. This is not my turf. That's too complicated for pregnant women, and Greenwald products can help a little bit, but I leave that one for the physicians, the doctors. All right. So type 2 diabetes occurs when the body can't properly use the insulin that is released. This is a condition called insulin insensitivity or resistance. Some cases are caused when it does not make enough insulin. As a result, the sugar builds up in the blood instead of being used as energy or as fuel. About 90% of people with diabetes have type 2 diabetes. Type 2 diabetes more often develops in adults. So how does insulin insensitivity or insulin sensitivity affect people with diabetes? Now, people with low insulin sensitivity, also referred to as insulin resistance, will require larger amounts of insulin either from their own pancreas or from injections in order to keep blood glucose stable in their bodies. In the long run, pancreas gets exhausted from overwork because lots and lots of insulin is pumped out from the pancreas, but not much results occur in terms of lowering the blood glucose level because of the insulin resistance. So as more and more insulin is pumped out of the pancreas gets exhausted and starts to become sluggish as well. Having insulin resistance is a sign that your body is having difficulty metabolizing glucose. And this can indicate wider health problems such as high blood pressure, and cholesterol levels may also be present. Now, having combination of conditions such as hypertension, high blood glucose, high blood lipids, and even high uric acid levels are called metabolic syndrome. In most countries, specialized hospitals in treating diabetes are not called diabetic hospitals. Instead, they are called metabolic hospitals. So, insulin resistance is a physiological condition in which cells fail to respond to the normal conditions or actions of the hormone insulin. The factory, that is our pancreas, still makes the keys, but the locks on the surface of the cells don't react. Instead of entering the cells to be used, glucose builds up in the bloodstream, leading to high blood sugar levels. So type 2 diabetes is what Green World products can help with. Okay. So how do we know whether a person has diabetes or not? There are three tests, basically three tests, and their lab results are used for the diagnosis of diabetes. The first one is called FPG. FPG is fasting plasma glucose. This is a blood test that measures your blood glucose at least 8 hours without eating. A reading above 126 milligrams per deciliter is the threshold at which diabetes is diagnosed. Now, if the readings are higher than this figure at two separate occasions, diagnosis of diabetes can be established. The second test for the diagnosis of diabetes is called OGTT. Otherwise, it is an oral glucose tolerance test. After you have gone at least 8 hours without eating, the next morning, the fasting plasma glucose is first tested. After this test, the person receives a dose of oral glucose. And then after 2 hours later, the blood glucose is tested. A person is diagnosed to be diabetic when two diagnostic tests done on different occasions or different days show that the 2-hour OGTT blood glucose level is higher than 200 milligrams per deciliter. The third test to diagnose diabetes is called HbA1c. It actually refers to the hemoglobin A1c test. Hemoglobin is the oxygen-carrying pigment that gives blood its red color, and it is also the predominant protein in red blood cells. So HbA1c refers to glycated hemoglobin or glycohemoglobin. Now, a level of 6.5% signals that diabetes is present. Okay, so those are the three tests that one can use to diagnose or establish diabetes in an individual. Most of you have taken this test and you have got results confirming that you are pre-diabetic or you are diabetic already. So that's that's for the blood tests that is done in the labs, in the hospital labs. Now, common types or symptoms of diabetes. Regular checkups are also important. As before I talk about the symptoms, regular checkups are required if you are above 40, overweight, or having family history of diabetes, or having sedentary lifestyle. But if you have any of the following symptoms, please contact your healthcare provider right away, because diabetes is a silent killer. It will dismantle your body slowly but systematically, right from your head up to your feet. It will destroy your organs, your skin and tissues, and so on, as we'll see later on. So here are some of the symptoms of diabetes: hunger and fatigue. Your body converts the food you eat into glucose that your cells use for energy. But your cells need insulin to take that glucose. If your body doesn't make enough or any insulin, or if your cells resist the insulin, then your body, insulin that the body makes, then the glucose can't get into those cells and you have no energy. This can make you hungrier and more tired than usual. So people with diabetes normally feel a lot of hunger and fatigue for that reason, because not enough glucose enters the cells to produce the energy that is required. The second symptom is peeing more often and being thirstier. The average person usually has to pee between 4 and 7 times in 24 hours. But people with diabetes may go a lot more. Why? Normally, your body absorbs glucose as it passes through your kidneys. But when diabetes pushes your blood sugar up, your kidneys may not be able to bring it all back in. This causes the body to make more urine, and that makes fluids or takes more fluids. The result is that you shall have to go more often and pee. You might pee out more too, because you are peeing so much, you can get very thirsty. When you drink more, you shall also pee more. So this is another symptom of people with diabetes. They pee more often and they feel thirstier often. Another symptom of diabetes is having dry mouth and itchy skin. Because your body is using fluids to make pee, there is less moisture for other things. So you could get dehydrated and your mouth may start to feel dryish. Dry skin can also make you itchy. Okay. Another symptom is blurred vision. Changing the fluid levels in your body could make the lenses in your eyes swell up. And when your lenses swell up, they start to distort the images. So they change, the lenses change shape, and this results into inaccurate focusing of the objects. The focus on the retina starts to change because the lens is distorted because of less levels of fluids. So those are some of the things that are common symptoms of diabetes. Of course, you have things like tingling feet or hands, and cuts and wounds that heal slowly, and unusual weight loss. These are also symptoms that you have to be aware and monitor. So complication of diabetes. As I said earlier on, that is very important to get checkups, your blood tests, because diabetes is a silent killer. It's going to dismantle your body systematically in a very quiet, and you won't feel some of these things until it is too late. Okay, so long-term complications. Diabetes itself does not kill, but it is the complications of diabetes that do kill you. And here are some of the complications of diabetes. Long-term complications of diabetes develop gradually. The longer you have diabetes and the less controls your blood sugar is, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. Possible complications include eye damage, retinopathy. Diabetes can damage the blood vessels of the retina, potentially leading to blindness. Lots of people I see who are blind, and sometimes I think it's because of the complications of diabetes. Many are due to complications of diabetes, the people who go blind. Diabetes also increases the risk of other serious vision conditions, such as cataracts and glaucoma. So eye vision is so important. The second complication of diabetes is kidney damage, otherwise known as nephropathy. I've talked about the kidneys and how glucose can affect the kidney and the filtration process. Now, the kidneys contain millions of tiny blood vessel clusters called as glomeruli. One is glomerulus, but the clusters are glomeruli. And these filter waste from your blood. Now, diabetes can damage this delicate filtering system of network. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which may require dialysis or a kidney transplant. I've had so many friends of mine who have succumbed to some kidney failure and sometimes irreversible end-stage kidney disease. Some have been lucky and got kidney transplant, but it is a serious case. So make sure that you keep monitoring your blood glucose levels to avoid these complications of diabetes. The third complication of diabetes is nerve damage or neuropathy. Excess sugar can injure the walls of tiny blood vessels called capillaries that actually nourish or give nutrients to your nerves, especially in your legs. This can cause tingling, numbness, burning or pain sensation that usually begins at the tips of your toes or fingers and gradually spreads upward. Lots of people complain of these sensations of tingling and numbness and burning sensation in their toes and maybe fingers and come to green wow. Now, left untreated, you could lose all the senses or feelings in the affected limbs. And for men, it's even more serious. This case of nerve damage or neuropathy can lead eventually to erectile dysfunction. So this is one of the complications of diabetes for men, erectile dysfunction. The fourth complication of diabetes is foot damage. Nerves that are damaged in the feet, or if you have poor blood flow to the feet, this can increase the risk of various foot complications. Now, left untreated, things like cuts and blisters can develop serious infections, which often heal very poorly. These infections may ultimately require toe or foot or even leg amputation. So watch out, be careful. You may lose your feet or legs due to this damage as complications of diabetes start to strike hard in your body. Now, the fifth complication, and the very serious one, is the cardiovascular disease. Diabetes dramatically increases the risk of various cardiovascular problems, including coronary artery disease with chest pain, angina, or heart attack, increases stroke, and also the narrowing of arteries, atherosclerosis, that increases those kind of issues start to become regular and often if you don't watch out. If you have diabetes, you are more likely to have heart diseases or stroke. So these are the complications of diabetes. Of course, diabetes may leave you more susceptible to skin problems as well, including bacterial and fungal infections, and even, as I said earlier on, Alzheimer's disease. So there is now a big connection that is being studied between diabetes and Alzheimer's disease. And some people call it diabetes type 3. But that's for another day. I'm not going to get into that today. So here we have a few tips for diabetic people. A few tips if you are diabetic The first one is eat low GI, glucose index foods, low glycemic index foods. Some foods such as white bread, refined rice, highly processed foods, sodas, and commercial juices, they spark glucose spikes in your body. You must avoid those foods as much as you can. Go for vegetable or fiber-rich foods such as bran, oat, whole wheat. These have less impact on sugar rise, and these are the right foods for diabetic people. Second tip is you should have frequent or mild aerobic exercises at a duration of 20 to 30 minutes with 5 to 10-minute warm-up. So indulge in some exercises, aerobic exercises. This will encourage the blood flow and also burn some calories and therefore use more fuel and so on. So that's the third one is take appropriate medication. We in Green World never suggest diabetic patients to cut or stop using their orthodox medication. It's up to you. We don't tell you to stop using that medication that you have been using or given prescribed by your family doctor. Green World products may help you put blood glucose levels under control or even reduce the dosage of your medication. And our products work better on controlling the complications of diabetes. The fourth tip is diabetic patients should have regular checkups, including fasting glucose test, oral glucose tolerance test, and hemoglobin A1C test. These are the tests that I showed a few minutes ago. Besides, if you have any early warning signs, such as blood vision, go for a fundus examination. If you have chest pain or palpitation, go for an ECG or echocardiogram test. If you find your urine gets cloudy or your urination habits are changing, go for a urinalysis to watch the complications and control their progress is the key for diabetic people. So be proactive. There are 3 products that help lower your glucose levels. These products are in Green World. The first product is GlucoBlock capsule with balsam pear powder, folium mori extract, radix astragali extract, folium ginkgo extracts as the ingredients. This product, GlucoBlock, helps lower your blood glucose levels steadily. All the 4 herbal ingredients contain varieties of antioxidants. So this product is able to neutralize free radicals that could further damage the microcirculation and nervous system in diabetic people. Take 2 capsules in the morning. The second product is balsam pear tea with balsam pear powder and green tea powder. This product is an excellent substitute for soda and commercial juice. So forget about those sodas and commercial juices that are advertised. Just steer away from them. Instead, you drink your balsam pear tea and drink 2 to 3 bags in a day. That's about maybe 3 cups. This can help control your blood glucose level. The third product is chitosan capsule. It is hailed as the fat magnet. Chitosan chelates glycerides and cholesterol in small intestines. Then it carries these glycerides and cholesterol out through bowel movement. So chitosan has been proved to be able to prohibit alpha amylase and alpha glucosides, which are the two key enzymes involved in breaking down sugar into glucose, thus delaying the sugar spikes after meals. Take 2 capsules after lunch and supper, and this will help control your blood glucose level. Now, pancreas is the only organ that produces the only hormone that lowers your blood glucose level. That is the insulin. People taking glucose-lowering products should monitor their blood sugar levels closely and inform their healthcare givers to minimize the blood sugar fluctuations. Modern medicine can only help us bring down the blood sugar level. So far, there is no cure for diabetes, and the wrong genes will be passed on and on, generation by generation, until we find the right cure. Therefore, take care of your pancreas, which is the only organ that produces insulin, the sole hormone to lower your blood sugar level. Thank you for listening to this presentation, and I hope you have got a few ideas and tips from it that you can apply to yourself if you have diabetes, or help others that may be suffering from this dreadful disease, diabetes, which is a silent killer, very deadly, very quietly. It dismantles lots of our organs and tissues. Thank you very much. And now I end here, and you are able to ask any questions that may be